Well, I want to welcome everybody and thank you for joining us today. I'm very excited to kick things off. We have two wonderful um, speakers who have a lot of information to share with you today. As those of you who have participated before, you know that we use this session to really give an overview of anticipated um, priorities, both for the governor's administration and for the General Assembly, and to share sort of high level what to anticipate and what to follow that will impact Virginia communities. Uh, we have two wonderful speakers today, and the way that this session will go is Julie Dime from the Virginia Hospital and Healthcare Association will go first and give a brief overview both of the session and then the what they will be following throughout the next 45 days. And then Ashley Kenneth from the Commonwealth Institute of Fiscal Analysis, who has been with us several times, will talk about the budget and budget implications and a few other items that they'll be following throughout the session. And then we'll leave a little bit of time for questions and answers and wrap up by 3 o'clock. So with that, I am going to turn it over to Julie Dime.
Wonderful. Good afternoon. And thank you, Bess. And thank you guys so much for having me. I'm delighted to be with you all today. We are in our downtown office, but I will tell you that the bathrooms are a little shaky and the drinking water is a problem. So we're off to a little bit of a rough start here for the 2025 General Assembly session. Obviously, just a general reminder, though, of the importance of safe, clean, and a functioning water supply. That should not be taken for granted. So that is good news. We've all now remembered how important a clean, safe, functioning water is. So with that, let me provide you a quick overview of the session. It is a short session, means we are in session for 46 days, hopefully no longer. And the theme that we're really hearing this year is get in and get out. With the House up for re-election, all 100 members are up for re-election this year. The Speaker and other leadership have made it clear that they do not, or they were hoping to avoid major controversial issues, but we've consistently heard that every year, and yet there seems to be significant controversial issues that continue to appear. So for what it's worth, that is what we've been told, but we'll see certainly as session progresses. Only amendments to the biennial budget will be considered. So we adopted the biennial budget last year. So these will just be amendments to the budget. And again, all 100 members of the House are up for re-election. There are roughly 7 to 10 seats that are truly in play. Of course, could be more. Typically, Virginia goes the opposite of what the presidential, who is the presidential party that is in DC. And so most folks believe that Abigail Spanberger has an upper hand going into next year. And as of right now, she has no opposition, although there continues to be some talk about Congressman Bobby Scott, who may enter the race. There are 8 Republican seats in the House that were won by Vice President Harris. So those seats, of course, are ones that the Democrats will be looking at. And then on the Republican side, there are about 3 House seats that are currently held by a Democrat that Republicans feel like they have potentially a shot at. And then, of course, we have our statewide elections, our governor, lieutenant governor, and attorney general. Right now, for lieutenant governor, on the Democratic side, that's a very hotly contested primary. And the primaries will be in June. And on the Attorney General side, it looks like that the current Attorney General, J.C. Miyares, has cleared the field, and it does not look like on the Republican side that there will be a nomination, a primary for that. On the Democratic side, however, Jay Jones is running, and also Shannon Taylor. I think I got that right. Yes, Shannon Taylor is also running. So again, we'll start the season off by primaries in June. So now looking at session and the hot topics for this session, we know maternal health, taxes, education, voting laws, casinos, and guns are going to be topics that will be discussed this session. Skill games are still around. And we definitely will have those discussions, but it's unlikely that the outcome will be any different. As Governor Youngkin has said, he will continue to veto that legislation. That being said, every year during the General Assembly, you never know, and deals can get made on various different issues. So those are just things that outside of healthcare that we're watching. And as we enter the session, and speaking of this session and kind of the theme, VHHA is very mindful of how we advocate for or against particular legislation. And I think there's a lot of my colleagues that would share the same view, is that we know over the years, and certainly it is not lost on any of us, the devastation of the murder of the United Healthcare CEO. We think that could have been anybody we know, anybody that a loved one of ours. Healthcare is something that touches everyone. And of course, there are stories out there of healthcare that are not always positive. And we know how words matter. And I think for us, we are being extra careful in how we go about our business with our folks, our pharmaceutical plans, health plans, and then other provider specialty groups that we are discussing legislation with, and wanting to be very mindful of our words and how we go about doing that, because we don't want to add into some of the narrative that is out there that can really have a devastating impact personally on folks that are in the healthcare space. So I say that to say that is certainly something that VHHA is very focused on this year. We know that we are going to be perhaps at odds with our other partners in the healthcare space. That does not mean, however, that we can't do it respectfully, and knowing that there's a lot of sensitivities, particularly when we talk with our health plan friends and colleagues, and how we go about advocating for various different positions. So I did want to kind of put that out there and know that is in the back of our minds as anytime we go up and speaking to legislators, just being mindful of our words and the impacts that our words have. So the good news is, though, that Richmond is not DC, and although the majorities in both the House and the Senate are very small, you do definitely see still a sense of civility, in a sense of being able to work together, and not everything has to be political. Now, there are a lot of things that are, but not everything has to be, and there's still that level of collegiality that we do see here in Richmond, which I hope we'll continue to see, and that we don't go the way perhaps of DC. So I want to talk a little bit about the constitutional amendments, and these are going to be controversial. There are 3 constitutional amendments that are being proposed this year. The House of Delegates, the Privileges and Elections Committee, have already met, and they have passed on that could be heard on the floor even early as this week, if things get off to a more seamless start tomorrow. There are 3 constitutional amendments that will be on the floor. One is related to abortion. This is a proposal to protect access to abortion. And this will be a key contention point for both Democrats and Republicans this year. The proposal states that every individual has the fundamental right to reproductive freedom, including the ability to make and carry out decisions relating to one's own prenatal care, childbirth, postpartum care, contraception, abortion care, miscarriage management, and fertility care. There was a little bit of confusion during the debate on this issue in committee about whether this amendment would stand up specifically regarding the parental notification or minors receiving an abortion. The committee's legal counsel said there's really not a clear answer, and that the United States Supreme Court would likely become involved. The amendment would also reduce the number of physicians to sign off on third trimester abortion from 3 to 1. The second one is related to voting rights. This is another one that advanced out of the committee. This is sponsored by Delegate Elizabeth Bennett Parker. It would automatically restore voting rights to individuals after incarceration for a felony conviction. And then the last one is removing the same-sex marriage ban. And this is sponsored by Delegate Mark Sickles. This would remove the language from the Virginia Constitution stating that a marriage is only between a man and a woman. This section of the Constitution and other related provisions are no longer valid due to the United States Supreme Court's decision, which allowed for same-sex marriage across the country. The Senate has its own proposals on these issues, on these three amendments, which still need to be heard in committee and then also passed out on the Senate floor. Constitutional amendments must be passed by both chambers of the General Assembly twice, with a House election in between. So before going to Virginia voters for a final approval. So there is a House election that will take place, of course, this November in 2025. They will have to come back in 2026, pass the same identical pieces of legislation, and then it will be on the ballot if that occurs, be on the ballot in November of 2026. So those are that's the constitutional amendment process and what we will be looking at this year in regards to that. So now turning to VHHA's legislative agenda, we have 8 proactive pieces of legislation and then 6 proactive budget items. A significant focus for us is maternal and rural health. Virginia has 28 rural hospitals, 8 of which are critical access hospitals. Other Virginia hospitals that are not technically designated rural are nevertheless serve rural communities and patients. In recognition of the scope of challenges facing rural hospitals and healthcare providers, House Speaker Don Scott took action in 2024 to establish the House Select Committee on Advancing Rural and Small Town Healthcare. And it was tasked with assessing the state of affairs in rural health and care delivery. To support that work, VHHA established the Rural Health Task Force with representatives from Virginia hospital, health systems, and rural hospitals. We met over a series of months, probably about 4 months, to identify the most pressing challenges facing our rural hospitals. No surprise, what was facing our rural hospitals are very similar to what's being faced in our more urban areas as well, but a little differently on how we actually respond to those issues in the rural areas versus a more urban area. Really what came out of that, there were 5 buckets that we looked at: transportation, behavioral health, maternal health, which is a big one, and will be very much discussed during this session, telehealth, and transportation. And those were the buckets that we looked at. That's also very similar to what the special subcommittee heard as they made their way around Virginia. So everything that they'll be doing this year and that we're putting forward is something that really came out of these meetings that occurred both internally at VHHA with our members, but also with the select committee as they traveled around Virginia. And those include community health workers. We last year had a bill that would have VMAS do a rate and design plan amendment study that we would look at what the rate would be for a CHW if we were looking for a Medicaid reimbursement, and then what the design of the amendment would be that we would need to the plan amendment that we would need to put forward. We hit a little bit of a roadblock last year, but this year, thanks to a lot of folks, including all of our CHWs that are employed not only by hospitals, but by free clinics, health plans, and other providers. We know that they are crucial, especially for our rural areas, in delivering healthcare and allowing comfort and people to be comfortable with receiving care, perhaps in their home or at other locations outside of a provider's office. So we know that we use them effectively, the health plans and others use them, and we are interested in and would like to pursue a Medicaid benefit. We know that initially there would be some costs, of course, but we think over the long term that having this Medicaid benefit would actually reduce costs in the Medicaid program because CHWs can deliver healthcare and help promote healthcare at a much lower cost. So that is one area that we are focused on, and we've got a lot of help in that area and support amongst legislators, but also other partners. And graduate medical education is another area that we are looking at. We know that we're experiencing some challenges with OBGYN and maternal care in our rural areas. And that is volume. There's lots of reasons that would go into this. And I noticed that Dr. Hazel is on. He certainly could probably speak to this better than I even about some of the why we don't have enough OBGYNs and other professionals going into our rural areas. But one of those areas is right now, Virginia pays about $100,000 per slot per year. That is mandated in the budget. It's capped at $100,000. The national average is $187,000. So we would like to get closer to that mark. And the governor put in his budget for specialties of OBGYN and behavioral health. He put in $150,000 per year per slot. That's a good start. And if that were to hold, certainly that would be helpful. But we eventually would like to get up to that national average. We hope that this would entice more providers to come to rural areas and have their residencies in more rural areas. We know that if someone has their residency in an area, they're likely to stay in that area. So we're hoping to draw some attention to our rural area by perhaps having this as a leverage. The other one I'll mention is remote patient monitoring, and this goes back to our maternal health and the benefits of remote patient monitoring when we're looking at our Medicaid population. Right now, you are eligible if you are high risk, if you're a Medicaid covered entity, you would receive, if you're high risk, you would be able to have remote patient monitoring. And so what that means is that a provider could monitor your vital signs like your pulse ox, your blood pressure, your glucose, remotely without you having to come in. And this can give the provider an indication if things are starting to trend in a negative way. And if they are, they can get you in or find other ways for you to come in and get the care that you would need in person. This is particularly helpful when we're looking at postpartum. And we know that even if you're not deemed high risk coming out of the hospital, that potentially things can happen and that you could go to high risk very quickly and may not even realize it. We know this happens a lot with blood pressure, and that is certainly a leading cause. Cardiovascular is the leading cause of death in maternal health patients postpartum. So we do think this would come in very handy for our Medicaid patients to have once they are postpartum. So this is one thing that we would like to see. We know this is going to, we'd like to apply to all Medicaid patients, but we know that may not necessarily be an option because it would be quite expensive to do that. So we're trying to figure out how do we expand that definition of high risk and to be able to include more moms in that definition. So we're still working that out, but right now our legislation just has it that it would include all Medicaid patients that regardless of whether or not they were high risk, but we know that's a big number. So looking at trying to at least have a start so we can expand that and add more patients in. And I think the last thing I have on my agenda to talk about is the Medicaid expansion trigger. And if you were around in 2018, as many of you I'm sure were, you know how important Medicaid expansion is in Virginia. It certainly is to our hospitals, to our members. So much so that you may know that our hospitals are paying the 10% state share for expansion. We've heard that certainly there is discussion up in DC about Medicaid and perhaps what the Trump administration may be looking at in the way of healthcare. There are a lot of things that they could look at, including Medicaid, and it's not surprising that Medicaid would be one area that they would look at. However, in Virginia, well, let me start with this. 41 states have passed some version of Medicaid expansion. 9 of those states, including Virginia, have a trigger. That is, if Medicaid expansion were to go away or were to drop below the 90-10, then Medicaid expansion would go away in Virginia. Now, whether I don't anticipate that this is going to happen anytime soon. I think there are other things that perhaps are on the Trump administration's agenda, and not this one. Now, certainly what happens in years out, certainly no, I don't feel confident saying that it will never happen. But I think for this year, what we've heard is that they are looking at other proposals, not directly at Medicaid expansion itself. Generally speaking, though, when something like this were to happen, it would be very much unheard of, very unconventional for the federal government to say, we're going to end Medicaid expansion. We're no longer going to have the 90-10, and we're going to end it today. Generally speaking, there would be some sort of off ramp that would move into place. Virginia would have time to respond. Is the bottom line. And when Medicaid expansion was negotiated, the trigger was a part of that negotiation, and it was in there for both the state, but also for hospital members who are paying that state share, to make sure that there was some recourse or some ability to call us back into a special session to figure out how we would maintain Medicaid expansion. So I know there is some talk about potentially removing the trigger. At this time, VHHA would not be supportive of removing that trigger. We do, however, will continue to support Medicaid expansion, and do our part certainly to maintain what we have here in Virginia. And again, this is not something that we're incredibly concerned about today. And we do think that we would have the opportunity to come back into session to figure out, depending on, of course, what the federal government does, how then we as a state would address expansion and continue to provide access to healthcare for those currently under expansion, but also the existing population. So, this is just one thing we continue to hear about, and that we're watching very closely. We are, again, I can't underscore enough the importance of Medicaid expansion and what it's been for Virginia. But the trigger, we don't think we're at risk right now enough to indicate that we need to do something about the trigger language. So that's where we stand today. And that is really what I have. I'm happy, of course, to answer any questions, I think, after Ashley goes. But it can certainly dig in a little bit more to anything that we're looking at, or if anybody has any questions, you can certainly find me offline at jdime@vhha.com. And I certainly probably have my information.
Thank you, Julie, so much. And we will have time for questions later on in this session. So at this point, I'm going to turn it over to Ashley to talk a little bit about the budget and a few other high priority things.
Wonderful. I am sharing my screen, so hopefully you all can see this now. Awesome. Well, thank you so much for having me. I'm glad to be back. I always enjoy doing this briefing as well as the end of session briefing, and catching up with all of you about what is going on. So For those who are not familiar, the Commonwealth Institute is a 501c3 organization that does policy research, analysis, and advocacy in order to advance racial and economic justice in Virginia. We are a critical player in Virginia's progressive ecosystem of policy, advocacy, and grassroots organizations who are all working in partnership together to build power with communities of color and people with low incomes so that together we can break down barriers and create opportunity instead. Fiscal policy is our primary focus, which means that a lot of the work that we do centers around looking at the state budget and breaking down complicated information so that the average person can first understand and then have the tools to advocate to make our state budget more equitable. I often say that our budget document is a moral document. It indicates who and what we value as a state in terms of where we direct resources. And it's about all of us using our taxpayer dollars. So we should have a say in how we bring in revenue and therefore how we spend it. Today, I'm going to start with some overall themes of the 2025 session, kind of building on some of the things that Julie mentioned. And then I'll dive into Governor Youngkin's budget amendment proposals, as well as some alternative proposals that we think would better serve people of color and families with low income across the state. To start, as Julie mentioned, this year is a budget revision year. The General Assembly passed the biennial budget last legislative session, and in odd years when we have a short session, the focus is on revising the budget based on new revenue forecasts. This is also an election year, and we anticipate seeing many brochure bills or bills that are intended to be used as messaging tools in order to make a political statement. So we'll see things like voucher bills for education or anti-immigrant legislation, for example. And with mixed control over the government, the Democrats holding the House and the Senate, and our Republican governor, getting bills passed and signed has proved to be difficult. The governor has vetoed many policy bills in past years, so that does limit the option of passing progressive legislation. However, moving things through the budget process is a realistic opportunity. And this year, we will also be contending with real uncertainty about federal actions and the ways in which decisions may impact us at the state level. One huge concern, as Julie already indicated, is that federal programs may shift the requirements or even be terminated, with the Medicaid expansion issue being a primary issue that we're concerned about. And then, of course, inflamed emotions about the results of the federal election and what it could mean for our country and for our communities if some of the proposals that have been floating around are actually enacted. I wanted you all to see the typical budget process in the state. I think this will be helpful to understand where we are and is also a good example of some of the information that we provide to our partners and our advocates to help them along the process. Once the General Assembly session starts tomorrow, we'll be heading into number 4, and Budget Sunday is anticipated to be on February 2nd, and that's when we will see the House and the Senate budget proposals and be able to compare those to the governor's budget proposal. Every year, TCI produces what we call our budget side-by-side document, and it's a summary of the budget proposals. Our summary of the governor's proposal just came out today, so you're getting this information hot off the presses. You'll be able to find that on our website, on social media, and we're going to send out an email shortly with the link to that. One way TCI is working to move Virginia forward is through the work that we've been doing with grassroots direct service organizations, cultural workers, and advocacy partners in terms of dreaming and working for an agenda of policies for communities of color and low-income families, which we've called the Collective Agenda for Virginia's Future. All of the issues that we work on at TCI are tied to this agenda and therefore tied to the communities that are most impacted. So you'll see some quotes throughout the presentation from some of our collective workers who are members of our Racial Justice Coalition, comprised of community leaders from across the state. Centering their voices and their lived experiences helps us to maintain a focus on people-powered policymaking and policy solutions that will truly transform Virginia into a place where all of us can thrive. So let's take a look at the governor's tax policy proposals. The car tax has been an issue of contention for many years, and the governor has proposed a car tax credit, which would create a 3-year fund for a refundable credit to certain people who pay a car tax. It would be $150 credit for single filers making up to $50,000 a year, or $300 for joint filers making up to $100,000 a year. Some issues offhand with this proposal is it doesn't get rid of the car tax. It's also limited to people who own a car. And TCI has already been able to disaggregate data by race and found that of income eligible households, 80% of Black families would benefit, 82% of AAPI families, 83% of Latino families, but that's compared to 90% of white families. So there's a not insignificant racial disparity with the proposal. Youngkin has also proposed no tax on tips. This would create a tax exemption for tipped income starting in tax year 2026. Some concerns here are that wealthier individuals could take advantage of this. Think a lawyer who could shift some of his pay to tips as opposed to direct pay, and therefore not pay taxes on those tips. It's also somewhat arbitrary in terms of winners and losers. A child care worker who earns the same amount as a waiter, for example, would not benefit from this provision. The governor also proposes to continue the standard deduction increase, which that was set to expire and go back to a lower amount. And he's also proposed something called market-based sourcing, which changes the calculation of sales factor for corporate income tax. This is an issue that we are doing some research on in order to be able to explain it to applicants. As I've already indicated, there are significant flaws in the governor's proposal, and what's even more glaring are the omissions. There are no significant revenue raisers. This leaves very little ongoing funding needed to invest in our shared priorities. There are no family-centered tax credits. The governor's tax proposals do not meet the needs of many of Virginia families and ignores low-income families without cars. There are stronger proposals on the table, and TCI is working alongside our partners on those proposals. One proactive policy proposal is that TCI is working on with several folks in the Tax Fairness for Virginia Coalition is establishing a new fair share tax. This proposal would establish a new income tax bracket for people who earn over $1 million a year in income. Right now, a millionaire and a firefighter pay the same amount, the same income tax rate, even though their salaries are vastly different. And if millionaires paid their fair share, we could generate over $3 billion per 2-year budget, which would give us more money to spend in the areas that we all care about, like housing and education. And this proposal would only impact 0.4% of tax filers. There will be legislation this year carried by Delegate Hernandez and Senator Mamie Locke. We are continuing our work to make more of the state earned income tax credit refundable and permanent, so all qualifying families can receive the full credit for years to come. And another option for lawmakers to consider is to increase the amount of the credit to put more cash back in the pockets of families with low incomes. And this is being championed by Delegate Price in the House and Senator Rouse. The governor proposed to make the standard deduction changes permanent, as I mentioned, but not the earned income tax credit changes. And if you do one, you really should do the other. So that's one thing that we will be watching and advocating for. We're also advocating to create a Commonwealth Kids Credit to give families a boost and build upon the success of the temporary enhanced federal credit in 2021. And that legislation is being championed by Delegate Tran and Senator Aird. Switching over to education, what we want is pretty simple. A Commonwealth where every community has high quality public schools, where children can thrive no matter who they are or where they come from. And we want this because our children deserve it and because we know 2 things. First, that funding makes a meaningful difference in student outcomes, particularly for students from low-income families. And second, that high-quality public schools are the foundation of a strong multiracial democracy. Making a meaningful difference in educational opportunity is a big task, of course, but we know that advocacy works, and we are proud to have worked alongside the 24-member Fund Our Schools Coalition to have meaningfully increased funding over the past 6 years. We're now back above inflation-adjusted per-student funding levels from before the Great Recession, and we have every intention of continuing to make progress until our students have the resources they need to learn and to thrive. So now down to the nitty-gritty for this session. There has been a lot of attention in the last 2 years on early childhood education as the state providers and families have faced a cliff in terms of the expiration of federal pandemic funding for childcare. Last year, the governor and lawmakers worked together to address this cliff and add state funding childcare slots. But despite this investment, Virginia still faces a waiting list for childcare help, and more funding is needed to help every eligible child attend a high-quality childcare program, which of course then in turn helps their parents maintain employment. The governor's budget proposal provides some funding for capital grants for childcare facilities, but does not provide new funding for operations. Instead, the governor proposes to address the backlog by shifting some cost on local governments by adjusting the local composite index for the VPI program and onto families by adjusting copays. On K-12 education, we see mostly technical adjustments in the budget proposals. There's some one-time funding, so not ongoing funding, but one-time, and the allocation of construction dollars from the state's existing special funds for K-12 education. The governor also proposed additional funding to create more lab schools at historically Black colleges and universities, as well as what is essentially a private school voucher program. Yet in the way the program has been proposed, there is no accountability measures, there's no discrimination clauses or transparency measures, which obviously is a significant concern. As in K-12, the governor provides relatively modest proposed changes for higher education beyond backfilling the funding need for the Military Survivors and Dependents program, which has seen very quickly growing use. But one thing I do want to note is that within the nursing scholarship programs, there is extra immigration-related restrictions in the budget language for Hispanic serving institutions. And as far as we can tell, those restrictions don't exist for any of the state's other higher ed scholarships. So that is something to certainly watch and hold lawmakers accountable for. In terms of TCI's K-12 priorities, we know that Virginia students are navigating a mental health crisis. And when we prioritize our students' mental health, it allows them to focus on their classes, contribute to positive school environments, and prepare for life after graduation. We know that we can provide our students with better mental health supports by increasing funding for the school-based mental health program and by giving schools greater flexibility with those funds so that they can implement supports that are tailored to their students. In summer of 2023, JLARC, which is the state's independent review commission, published a comprehensive report on Virginia's current public education funding, showing yet again that the state is not sufficiently funding our public schools. And TCI, along with our partners, are supporting implementation of JLARC's near-term recommendations and add-on funding inspired by one of their policy options in the report, Policy Option 5, in order to improve our support for English language learners in particular and students with disabilities. We also support the recommendation to fully lift the support cap so that schools can hire all of the staff that they need to make sure that their schools are running efficiently and students get what they deserve. Safe and restorative practices in public schools focus on encouraging positive relationships and using evidence-based approaches to guide student behavior. And so restorative practices are designed to prioritize student safety by creating environments where they feel welcome and supported, leading to fewer disciplinary issues. They can also reduce the use of exclusionary discipline methods, which reduce learning time and are disproportionately used against students of color and students with disabilities. And we believe that we can foster more restorative school environments by increasing funding for restorative practices, by funding a 2-year Restorative Schools in Virginia pilot program, and providing additional funding support to localities with high rates of community violence through the Safer Communities program. We know that different students face different challenges, and creating schools where every student has opportunity means investing in the funding supports for the groups that face the biggest barriers. So again, that means increasing funding supports for students with disabilities, English language learners, as well as students from under-resourced communities. And we just need to make sure that a student's zip code doesn't determine the quality of their education. And that's a priority that undergirds all of our work. So we will be supporting a budget amendment to provide additional funding to schools deemed off track and needing more intensive support by the Virginia Board of Education's new standards. Just a few slides on healthcare. Due to unforeseen circumstances, there was a large Medicaid shortfall coming into this budget year. And while Governor Youngkin did not cut funding to the program, potentially harming access to coverage, he also did not choose to further invest in the program. He has proposed creation of a new Medicaid reserve fund that would require any new Medicaid initiative to fund the regular biennium cost, but also the difference between the second year cost and the highest cost year of the program over the next 6 years. So that difference would go into this fund, and the governor could also access this fund anytime to pay for Medicaid shortfalls. But we're afraid that this new funding program could disincentivize, if I can get that word out, new Medicaid initiatives due to the need to identify extra funding on top of the 2-year costs. Maternal initiatives include $2.5 million in one-time grants to community-based providers to reduce maternal and infant mortality, $1 million for doulas at our local health districts, as well as a social media campaign on the warning signs of maternal health complications. What we'd like to see is for lawmakers to continue investing in the healthcare for every individual. And the policies listed on this slide are mostly budget amendments that we hope to move forward during the session. Cover All Kids has been included in the Senate budget for 2 years running, and we hope it will be included for a third. Continuous eligibility for children ages 0 to 6 is a new policy proposal. The 12 states have already taken action. We know that too often young children lose coverage and experience gaps in healthcare simply due to administrative hiccups. And since April 2023, roughly 42% of all disenrollments of Virginia children from Medicaid were closed for procedural reasons. And so our budget amendment would make sure that young children have continued access to coverage. Emergency Medicaid for cancer treatment is another proposal to make sure that more families can focus on treatment after a cancer diagnosis instead of having to worry about charity care options and how to pay out of pocket for treatment. And then, of course, paid family and medical leave is something we've been working on for year after year. And access to paid leave is critical for Virginia for working families. One big proposal under criminal legal reform is regarding earned sentence credits. It's important to remember that the budget is a policymaking document that overrides regular laws while it's in effect. So even for things that aren't money related, one of the governor's proposed amendments tries to use budget language to limit earned sentence credits, what are colloquially known as good time credits for some incarcerated people. And these credits encourage and reward good behavior and participation in education and job training programs and can lead to better outcomes upon release. So it is a concern that the governor has chosen to limit those. And the last big issue that I'll mention is raising the minimum wage, which continues to be a priority for TCI and many of our partners. With rising prices and a higher cost of living, we need to get back on a path to a $15 minimum wage. We will see legislation on this, but it will likely be vetoed again by the governor. However, we're laying a path and a foundation for 2026 in case a Democratic governor is elected, we'll be able to move quickly and get that legislation over the finish line. And I just want to end by inviting you all to join us this Friday for a webinar that we're hosting to dive deeper into some of the proactive policy priorities that we're working on for 2025. And we'll also share opportunities for you and other advocates to plug in. Thank you very much.
Thank you very much, Ashley. That is, I think everyone got a lot of information from both of our speakers today. And while I have a question that I was going to pose, I thought we have 14 minutes left in our session today. I want to make sure that we give the opportunity for any of our folks and members on the call to ask any questions that you might have. So I don't know, I'm going to have some of my colleagues tell me if I see any raised hands here, but does anybody have a burning question for Ashley or Julie that you'd like to ask before I ask, I have a question that I'm going to ask them? Seeing none, I'll start, and then please feel free to take yourself on mute and ask your question if you have one. Ashley, I'll start with you, and then I'll ask Julie to also weigh in. What should we be watching for, both during and then after the session ends? What are some things that you would suggest that those interested in following either individual pieces of legislation or the overall budget, or what advice would you have?
Yeah, I mean, certainly follow TCI on social media or sign up for our newsletter. We put out regular emails during the session to provide updates on all of these issues. And we also have a session webpage on our website with resources and one-pagers and things to help folks advocate. Of what I mentioned today, I think this is kind of where Julie and I may differ, but I think the Medicaid expansion trigger language is something that we really do need to pay attention to, because there is potential for nearly 700,000 people to lose access to healthcare. So that's one thing to watch carefully, how that moves forward, and if the language is removed or if it's adjusted, how that could impact folks' healthcare. And then, of course, tax policy. I think this is going to be a really big session for tax policy. And we'll just remind folks to read between the lines on legislation that we're going to see, and not get distracted by some of those, culture war brochure bill type pieces of legislation that we may see, but really consider, what our neighbors and our communities need to thrive in the time period that we're in, and focus on those big issues.
Thank you, Ashley. Julie, is there anything that you would say that Ashley may not have shared that our members might want to focus on, what they should be watching for, and both during or after the session?
Sure. Well, I think Ashley said it very nicely. I think we are watching. I think as soon as we adjourn here, we will turn all of our attention, of course, to DC and kind of the impacts that we're going to be seeing coming out of DC. So I think definitely that is on our agenda to be watching the rest of the year. But I think just what the narratives that are coming out of the elected officials and those who are running for office always is a good indicator of what the focus is going to be for the next General Assembly, and what might be coming ahead. I do think if Democrats feel very good about their chances of keeping the House, and also then taking the governor's office, lieutenant governor, and then potentially attorney general as well. So what that looks like, if we have a one-party rule, we're about to see, of course, what that looks like on the federal level, and then we could potentially see what that looks like next year for a state level. So I, for one, sort of like it when I like the closeness of where we are, both on the federal and the state level, because I think it gives everybody an opportunity to work with each other, and the product is usually much better better when you have both sides coming to some type of an agreement and through compromise. So that's what I always look for, is I want to see what's coming out of the campaigns, what they're focused on, because that's certainly a good indication of what, by and large, their agenda will be.
Thank you for that. So I know that we have folks on the call that are not shy, but I'm not seeing any raised hands for who might like to have a follow-up question to either of you. I think that one of the questions that I have, and for either of you, knowing that our members on the call are grant makers and funders, of philanthropic funders, what implications do you see for their work in what you all have shared today about what we can anticipate happens during this General Assembly session? Where should philanthropy play a role, or what implications do you think there are for philanthropic funders?
So this may not be directly related to this legislative session in particular, but I think in general, funders could play an important role in supporting nonprofit organizations that are doing this deep racial equity work and who are kind of thinking about the big progressive picture, because it is a scary time and we need support and we need backup and we need folks to amplify our message. And so I think that's one way that funders could play an important role. And then, of course, also supporting especially some of the smaller grassroots organizations who are doing advocacy work, making sure that they have a seat at the table, and offering them opportunities and amplifying the voices of those folks as well.
Thank you, Ashley. Julie, do you have any other thoughts?
Yeah, that's the only thing I would say. I would say that innovation is key. Government can't do everything, shouldn't do everything, but where government either drops off or doesn't pick up, I think that the philanthropy space is one that is always there to pick up the slack, but also provide solutions. And provide innovative solutions that maybe government either hasn't thought about or doesn't have the ability to think about. They're too restrictive in what they can and cannot do. But I think that's where you all have the advantage of, you can do what you want to do by and large, and when you want to do it. And I think that is awesome. And that's an awesome responsibility to have, that you have the ability to make a difference that maybe government can't, and innovations that you can bring to government, I think is something that I would hope that, and I know many of you on the call do on a daily basis, are looking for those. And we've got challenges all over the map when it comes to healthcare and other spaces too. But healthcare is one that has benefited from great innovation. So if there are things out there that you think or could be looking at, that your organization's looking at, supporting would be, I think bringing that to our attention, bringing that to legislators' attention is always well received.
Thank you. I do see that Debbie Oswald from the Virginia Healthcare Foundation has her hand raised. Debbie, can you hear us? And do you have a question?
I can. Thanks, Beth. This is a question. Well, you both could certainly, I'll bet, have opinions on this, but Ashley, in particular for you, I know there's been a push to cover undocumented children for several years now, and we've, not quite we make little headway here and there, but haven't really made it over the finish line. I wonder, especially in the midst of such an anti-immigrant mood right now, if a more productive path might be, or an equally productive path, I think more productive in getting it passed, I guess, would be to change to increase the eligibility level for the CHIP program from, the 205% of poverty up to like 250%. Virginia, we used to be at the top of the states in terms of the eligibility level for kids. Now we're in the bottom two. And lots and lots of other states have increased eligibility for kids, up some to even 300% of poverty. I think that might be a little rich for our blood right now here in Virginia, but that 250% number seems like it could be achievable. And I realize it's sort of weighing one group of kids against another in a sense, but among the advocates and stuff, is there an appetite for trying to increase the eligibility level for the CHIP program?
Yeah. Hi, Debbie. First of all, it's good to hear you. There is an appetite for it. I think that advocates have been talking about it for a number of years. I know that TCI has done some initial research on it. I don't know the cost off the top of my head, but I know that we have looked into that, and we'll probably try to push legislation forward in the future on it. I think it's a both and situation. I think that we need to increase eligibility, but we also need to make sure that all children, regardless of immigration status, have access to healthcare, period. And so I think we need to do both. And I think the continuous eligibility provision that we're working on is kind of a step towards that as well, in terms of making sure that children under 6 have access to healthcare continuously, regardless of their changing circumstances. And I think that the conversations that we have about that, as that comes up during the legislative session, may influence, when we do introduce legislation to expand the eligibility for everyone. And I think that'll give us a good foundation to move forward on that.
Thank you, Ashley. We only have a couple minutes left, and I don't see any other raised hands unless one of my colleagues from VFN wants to weigh in if they see anybody. I wanted to, before I turn it over to Patty to close, I really want to thank our two speakers today, Ashley and Julie. You gave us a wealth of information, and I know that I think many of us were taking a lot of notes on everything that you shared, and are really grateful for your spending the time the day before the General Assembly is supposed to start, which I think it will. And for those of you that are not in Richmond, you might not know that some of what was alluded to, there was no water in the city of Richmond. So the General Assembly building was closed today. And there were some initial preliminary meetings, but everything's been canceled. So we hope to have the session officially start tomorrow, and hope we have good news on having water so that the legislators can do their work, or at least go to the bathroom while they're in the General Assembly building. So we're going to say that's not an omen for how the legislative session is going to go. I think it will turn around. One of the things that I wanted to announce is that, as you know, VFN has been doing some work on how we move forward with our policy and advocacy work. Much of it is learning, and as today's session is a part of. We also have benefited from a grant from one of our members that we were going to be able to provide a bill tracking service. So we're doing that in partnership with the Center for Nonprofit Excellence. We think that their work and what the nonprofit sector is really following will be helpful for you all too, to know what legislation is moving through the General Assembly and where it ends up. So please be on the lookout for that. You'll be seeing some more information in network news that as the session unfolds. And we'd love to hear from you after that to understand if that's been helpful to you, and hope that we can continue to do that service, so you'll know what Virginia is doing and about these issues that you all care about. Patty, I'm going to turn it over to you to kind of close us out.
Okay, great. Thank you, Bess. Again, thank everyone so much for coming today. It was great seeing so many faces. And Angie, thanks for that slide about some of our upcoming events, Foundations on the Hill, and something new for us, a watch party with the economic opportunity funders, so that you'll be hearing more about those things. And then we will be starting off the year all things conference in the next few weeks. So look for your network news and upcoming events to follow along with that. And be safe today, and we will see you again for our post-General Assembly session at probably sometime in March. Thank you.